For those watching on Zoom, we're going to get started in just 2 minutes. All right, I think for our panel, if you want to go ahead and take a seat, we're going to get started in just a moment. We are live streaming it, so we're reaching more people than our awesome folks who are in the room. So that's one thing we'll keep in mind. We'll be taking questions from the chat periodically and all that good stuff. Okay. We also have a panelist who's on Zoom, which is great. Yay! No, I think we're good to go. Okay. I just provide the notebook for fun. All right, let's get the panel up here. This is the microphone we're all going to share. This is for you. It's a little thank you for speaking on our panel this evening. Thanks.
Seeing your presence. Yeah, it's pretty cool. Oh, totally. Look into this place. Never ends with this.
Yeah, the whole thing, it's being live streamed, it's being recorded. Yeah, we got all the stuff. So we're right at 6 p.m. So I feel like it might be a good time to get started. Hello, everybody. My name is Caroline Nickerson. For those watching on Zoom, welcome. For those watching the Facebook live stream, welcome. If you're watching the recording later, we're happy you're here as well. Welcome to the Future of Health Research with All of Us Wisconsin and SciStarter. This is meant to be an accessible, fun event. So if you're here in the audience, we really want to hear from you. We want questions from you, and we'll run the mic over to you so our friends watching online can hear it as well. If you're watching online, don't be shy about putting your questions, comments, thoughts in the Zoom chat, as well as in the Facebook comments. If you're watching on Facebook Live, we'll be checking that periodically to hear from you, because this is your event. This is meant to be useful for you to make health research something accessible and something that you want to learn about. So I'm Caroline. I'm from the SciStarter team. I'm going to be moderating tonight's event. I'm going to go ahead and pass it to our panel to introduce themselves and a little bit about what they do. So here you go.
Hi, good evening. I'm Gina Green Harris, and I am the director of the Center for Community Engagement Health Partnerships. And in this capacity, I actually am one of the co-investigators of the All of Us research program, and as well as a co-director in that program. Have been doing this work, All of Us in Wisconsin, and since its inception, have been at the University of Wisconsin-Madison for the last 15 years doing the work that we do around equity, inclusion, and research.
Thank you, Gina. I'm Dorothy Edwards. I'm a faculty member in the Department of Medicine and the Department of Kinesiology at the University of Wisconsin-Madison. I'm also one of the two principal investigators for the All of Us program at the University of Wisconsin and part of the Wisconsin All of Us Consortium. I'm also very interested in equity and inclusion, particularly health equity. I lead the Collaborative Center for Health Equity at the University of Wisconsin in Madison. And my own research outside of All of Us is really looking at recovery from stroke in African Americans and also Alzheimer's disease prevention in African American communities.
Great. I'm Dr. Susan Passmore. I work with Dorothy in the Collaborative Center for Health Equity at UW-Madison and also on the All of Us team. And I'm an anthropologist by training, so it's kind of strange that I would be involved in health research, but my research has to do with how can we build stronger relationships between health researchers and universities and the communities that they want to serve.
And then we also have a panelist joining us online. So if she can go ahead and introduce herself, Dr. Shiambola.
Yeah, well, good evening, everyone. My name is Olayinka Shiabola, and I am an associate professor at the UW-Madison School of Pharmacy. I'm also one of the associate directors at the Collaborative Center for Health Equity, working together with Dorothy and Susan, like they said. And the research that I do is on diabetes self-management, especially among Black and African-American populations, and also do a lot of work around health literacy and health equity as well. So happy to be here.
Fantastic. So I think for our first question, also for those who are here in person, we do have food. We have Jimmy John's. Make sure you eat that. There are tables here, so make sure you enjoy these tables after the event. I just wanted to put that plug in. And if you're not here in person, if you're watching online, you could have had food if you came in person to Milwaukee, just letting you know. But for our first question, I think because we got some new people registering for this event, especially the people watching online who don't know what All of Us is. So who wants to take that one? What is the All of Us research program? Nose goes, I guess.
So I'm more than happy to talk about the All of Us research program. So the All of Us research program is one of the largest research initiatives ever undertaken by the National Institutes of Health. And it's also the first time, the very, very first time in NIH history that we actually are doing a project that's fully inclusive, that actually represents the depth and breadth of people across the United States. The All of Us program is really designed to accelerate what we call precision health or precision medicine by making sure that we understand the conditions that affect all of us, right? All those chronic conditions, learning how to better prevent them or better treat them. So the All of Us program, the design is to recruit 1 million people, and we're getting close. We have about 450,000 people in our data bank right now. About 550,000 people have actually volunteered or in the process of completing the study, but it's really easy. To sign up for All of Us, you go online and you answer some questions and learn about the project and sign consent forms that have little videos with them. We ask you to complete some questionnaires about yourself. We ask our participants to give us access to their electronic health records and then to come in for a really quick visit to do some physical measurements like height, weight, and blood pressure, and provide a blood specimen and a urine specimen. The biologic specimens are banked at the Mayo Clinic in a big biobank, and they are being studied to do full human genome sequencing and pharmacogenomics, which is to look how your genetic makeup interacts with certain medications. And then the data, all the data is available in a place called the Workbench for anyone in the United States to use. And that's where the link with citizen science is, because anyone in the United States, anyone actually across the world has access to these data to answer research questions. So it's a really valuable study. And the other thing that's really important to know that most people don't know is that it was President Obama's dream to make the All of Us program come to life. And it's included in the Affordable Care Act, or the act that we, fondly call Obamacare. And the reason for its inclusion in the Affordable Care Act is that we need to make sure that the medical advances that are achieved by scientists, whether at the National Institutes of Health or anywhere in the world, actually apply to everyone, not just to white men or older white women, but to make sure that these scientific discoveries are available to address the most important questions in health. It's a little long-winded, but that's it.
Yeah, I think we got it. We got it all. That was awesome. So I'm going to ask myself a question. So what is SciStarter? Oh, I can't believe I just asked that. So SciStarter, I like that you mentioned the link to citizen science with All of Us. So SciStarter is a global citizen science organization. We're really honored to be partnering with the All of Us research program this Citizen Science Month. So people are able to go to SciStarter any day of the year, not just in April, SciStarter.org, and they're able to find a citizen science project they can do. So citizen science is a way that a member of the public can meaningfully advance scientific research, most often by collecting or analyzing data. So I consider all of us to be a citizen science project because you're giving your own data to the program. You know, that's an act of data collection in and of itself. And all of us wouldn't work without the participants, without the people who are getting involved and joining this effort. So I think of all of us as a citizen science project for sure. But there are lots of different citizen science projects out there. After the event, I'll be at my table. And if you're watching online, you can come to one of my other webinars and I'll do a citizen science project with you. But the one I'm doing tonight is stall catchers, where you can watch videos of blood vessels in the brains of mice and classify them for Alzheimer's researchers, making simple annotations saying whether the blood vessels are stalled or flowing. And by doing that, you're helping them accelerate their search for a cure. So in citizen science is as broad as science itself. It's entomology. That's a study of bugs. It's astronomy. You can study the night sky. You can map spiral galaxies as a citizen scientist. If there's a science for something, you can be involved as a citizen scientist, no matter your age, no matter where you are in the world. We've had citizen scientists participate in Antarctica, collecting phytoplankton just as volunteers. So people of all ages, all backgrounds can do citizen science. So in April, Citizen Science Month, all of us is our main project. So that's why we're doing events like this, going out into the community, getting in touch with people online from the globe, across the United States who are watching, just to get them excited, get them doing more citizen science. Citizen Science Month every April is just kind of an excuse to celebrate. And in that celebratory nature, I think we also try to make citizen science accessible during the month. So I know you mentioned with all of us, you know, it's working to make healthcare treatments better for everybody. And I know it can be a little complicated with precision medicine. So does anyone want to give an example of what precision medicine is and why the people watching should care? All right, we got it. Yeah, Dr. Dorothy again.
Panel members seem to think I know the answers. So I'm gonna tell you about my why, because I am a participant in all of us. I'm not just an investigator. And I'm a participant in all of us because my family has really severe heart disease. My father had heart valves replaced. My mother had a quadruple bypass when she was 55. My younger brother passed away at 43 of a heart attack. And I've had hypertension since I was 20. And I didn't smoke. I was really tiny. I weighed less than 100 pounds then. I had none of what known risk factors for hypertension. And I've been on blood pressure medicine since I was 20, hopefully to avoid a heart attack or a stroke. Well, I'm really concerned that my granddaughters and children are at the same risk that I was. And nobody can tell me, other than my genetic history, why I have what I have and why my brother passed away so early. So I'm hoping that by enrolling in all of us, that first of all, I'll understand why I have idiopathic hypertension. I've already found out that some of the drugs that are used for hypertension don't work well in me because I got my results back. And I really want my grandchildren to grow up and not have the same health risk factors than I do. So it was a really easy decision for me to participate. And I also would not ask anyone else to participate in a research project that I wasn't willing to do myself. And so that's my why. But I'm going to turn it back to Gina because she's been involved since the very beginning and has been a crusader for inclusion in research.
I think the question is, what is precision?
Well,
No.
Okay, so the new
No.
question is, what is your why?
What's your
Yeah.
why?
I like that question better. Pivoting.
So no, and absolutely, we all have a why, right? And so my why is definitely recognizing that in our community, quite frankly, we have so many different illnesses, diseases, and yet we know we are the least amount of folks involved or even welcomed into research. And so as a responsible citizen, as an advocate and a servant of our community, it is my responsibility, because I believe in the W.B. Du Bois talented 10th, that we are responsible for helping to make sure that our community is well educated with credible information. And we know that research is the pathway, quite frankly, for change of our health conditions, and whether understanding chronic illnesses better. And I believe this research study actually gives people a way to participate like never before. The fact that there is an intentionality around recognizing the diversity of this nation is really an important piece to this research. And when you think about the understanding that, yes, I would like one day, as Dorothy was saying, as my colleague is saying, that for my grandchildren or great grandchildren to understand that what is their genetic makeup, what is their genetic history, and not only know that, but have access to resources to really treat them in the way that they deserve to be treated and not like another number. So for me, it's really important. And as a person who, again, has been selected for this servant role, it is really important to me to make sure that I am helping our community have credible information so they can make really good decisions and really understand how critical it is for us all to be involved in research anymore.
My why is related. I think I'm really feel very strongly about how we need to move toward health that is equitably distributed through our population. Right now, that's not how it is because of, well, complex history, social, political, economic, disadvantage, and racism. I mean, there's a huge complex thing. But right now, in all of the genome-wide association studies, so all the genomic studies that are out there right now, African Americans or people of African descent are represented in a tiny little bit. The majority of people in those that are represented in those studies are people of European descent. So all of us trying to really reach out to a million people and representing the diversity of America means it's an opportunity to turn that around and to have that knowledge about the genomic makeup of our entire population. And precision medicine, using that knowledge to create treatments that really work for people is really important. I think about it, if we don't have that, we don't have everyone represented in that database, means that there's going to be only some people are going to get the benefit of the study. So that's one of those things. We'll be going backwards. We won't be working towards more equitable distribution of health. We'd be going the other direction.
Fantastic. So we also have our panelists on Zoom. So I'd also like to hear your why, and it could be about why you do health research generally. What's your reason behind the work you do?
So there are a lot of reasons why I do the work I do. And I study, like I mentioned during my introduction, I study diabetes self-management. I do diabetes research. And one of the things that is so common in diabetes research is the disparities that we see. We have data that suggests that communities of color have one of the highest disparities when it comes to the incidence of diabetes. So that means when diabetes is starting, we have Black African-American populations at least twice more likely to develop diabetes. And even when they develop diabetes, they are also at risk, almost twice the times more likely to also develop complications. So we see a lot of strokes happening, heart disease happening. We also see a lot of amputations, lower limb amputations, a lot of kidney failures, most of the times all related to diabetes as a disease. The only way we can move the needle in reducing these disparities is to participate in research. Something that is also important is there's currently no treatment for diabetes. And there's a lot of research that is going on to see if we can get a cure for diabetes, if we can find a way to not just reduce it from happening, but also find a way to deal with the complications associated with the disease. If we have communities of color, if we have African American, if we have other racial and ethnic minority groups as part of research and having their voices at the table, we can be part of those groundbreaking studies that will eventually lead to the treatment. Now, this treatment is not just going to be groundbreaking, but it will help reduce these incidences of diabetes happening that is causing all these complications. And it also reduces those complications, like I said, from happening as well. But we don't know if that treatment is going to be efficacious or not. We don't know if it's going to work well for our communities of color. Well, the only way we can make sure that it works for communities of color as well is to make sure that we participate in research is to make sure that we have our voices at the table, and we, of course, are at the table when all this groundbreaking treatment and hopefully cure for diabetes eventually comes to light. And so as somebody who also has a personal experience with diabetes, it's very important for me to put my voice on the table and participate in research associated with this disease. And then we can stem the disparities. We can stop it. We can eliminate it. It's been a priority for healthy people 20, 30 for a long time. And people say healthy people, we keep changing our goals and national objectives. But I think, you know what, instead of reducing it, let's just get rid of it and get rid of the disparities. And research is one of the ways to do that.
Fantastic. So we're hearing about the importance of this work. We heard the why from each of our panelists about why they do this work. So let's investigate what this work is. So with all of us in particular, people come in, they take surveys, they give some data, like blood samples, things like that. It goes to these researchers. What do they do with it? How does this work? How does research go from, data collected from participants to new treatments for diabetes? Who wants to take this one? All right, let's go for it.
So one of the most important parts about the All of Us project is what they call data democratization. So it's very similar to what citizen science is. In other words, the promise of the All of Us program was that the data that are collected would be available to anyone who had a research question, regardless of whether they were a high school student or a Nobel laureate, that everyone who had a question could come to where the data are stored and pose that question. So so usually in big research projects, you have to be an investigator who's funded by a foundation or the National Institutes of Health or some other major funding. But this democracy says that anyone who has a question can actually go into the database and answer that question. And we have data from about 400,000 people now. This is the most diverse, largest database of its kind in the world. And right now, there are about 4,200 people registered to use the data. And it goes all the way from high school students working on a class project, again, up to genetic researchers who are really trying to understand a particular disease syndrome in an area that they study. So it's very unusual because most research funding from the National Institutes of Health is problem directed. So Gina and I are part of the Alzheimer's Disease Research Center, and we study risk prevention of Alzheimer's disease. We do research around Alzheimer's disease. We may look at diabetes and Alzheimer's disease, exercise and Alzheimer's disease, but we're not going to look at lupus. And so this way, by providing the data, anyone with a good question can come in and use the data, and it's actually very, very easy to use. And that's really, really important. But the other side of it, and the part that many, many people worry about before they agree to participate, is whether their data are safe. And so the other interesting part and really important part of the All of Us study design is that we have something called the workbench. And the workbench is where all the data gets put together. So your data, my data, when I signed up, my personal data went into a database, my survey data went into another database, my electronic health record goes into a different database, and my biospecimens went to the Mayo Clinic. And in the workbench, all that information is put back together again so that my data is organized, but my name is not attached to it. But the other protection is that the data never leaves the workbench. In other words, researchers can't download it and work on it on their own computers. They have to stay inside of the research space so that all of us always knows who's using it, what it's being used for, and can also find out how people are reporting it, whether it's being reported accurately. And those are really big changes in the rules and regulations that govern data. And it's really, really important. And going from my why to precision medicine, to get back to that, is that when I was 20 and diagnosed with hypertension, and I didn't look like a person who should have hypertension, I took 10 different medicines before they got my blood pressure under control. Some of them made me sick. Most of them didn't work. There was no precision to what, because I didn't look like about 5-year-old woman who needed to be on medication, right? And so all of my life, they've struggled to keep my hypertension control. And so that's precision medicine. So someday, another 20-year-old who's hypertensive with no real reason is going to be able to go to a doctor and they're going to say, oh, what you need is this. And that's precision medicine. But in order to do that, we need millions of people, or at least 1 million people. And another example of why large numbers of diverse individuals are really essential for research is, and Gina will know this, Alzheimer's disease research really started accelerating in the 1980s. The first research centers were funded in 1985. It took us 22 years to get enough participants of African American descent to do the first genome study of Alzheimer's disease in African Americans. Even though African Americans are 100% greater risk, 22 years. And do you know what they found? 4 genes that white people don't have. 4 different pathways to Alzheimer's disease. But you know what? The medications that were being developed are being developed on the genomics that came out of predominantly white populations. So what's the likelihood that these medicines would work? Relatively low. And that's the reason why a program like All of Us is so important. We can't wait 20 years. It shouldn't take 20 years to find out that the pathways of disease are different, and therefore the prevention might be different and the treatment's going to be different. And that's the other why. And that's why All of Us is so important.
So I'm curious, so when people submit their data to the study, and let's say that the researchers analyze that data, they find these new genes, how does that translate to new treatments? Maybe Dr. Yinka, if you want to take this one, like how research translates into medical practice?
So, I mean, I'm not an expert in pharmacogenomics, but I will take a stab at it. I'm trained as a pharmacist, and one of the things we know is when the research actually happens, before we can actually get to the point of drug development and actually find new treatments or find new medicines, there needs to be a lot of evidence-based, it's called evidence-based medicine that needs to happen. And the research needs to go through that process of including people in something we call a clinical trial. And so when all the data is actually available for a researcher to be able to analyze the data, be able to maybe work in the lab, that is sort of starts the process for the pharmaceutical drug development that eventually then leads to the treatment and leads to the new cure, leads to the new medication that has been talked about. And so, but what happens is if we don't have enough profiles, genetic profiles of everybody that should participate, people of color, people from different racial ethnic minority groups, African American, Black populations, to be included in the genetic profile, that process of drug development and getting to pharmaceutical treatment and cures actually then gets to the point where it's only catered to only a specific type of population. And then that treatment eventually only works for one group versus the other. So one of the things I would say is having access to those, to an amassed amount of data and a mass of profiles helps to be able to get us started on pharmaceutical drug treatment and also part of the drug development process. And so researchers who are very focused on pharmacogenomics are also doing a lot of steps to make sure that the treatment that is available to everybody, but also thinking about how can we also individualize that treatment and figure out what treatment works for this group versus the other. Or maybe they all work. We don't know that question, but it's all part of the process to get to drug treatment and development and pharmaceutical treatments and drugs.
That was great. Yeah. So research can be a bit of a scary word. Um, I know for some of the people watching, I saw when I went live on Facebook, we had a library tuning in, for example. We often get on our live streams a lot of like moms and students tuning in, for example. And, they may have never thought of research before in their life. So when we hear these things, when we hear about research that's addressing health disparities, what's a way that, anybody and everybody can be part of research or interface with it? A non-scary way to get at research. Any panelist is welcome to take it. Make research not scary for us.
Well, I think that there's sort of a hierarchy of scariness, right? So there's research you can participate in where you're answering questions, where maybe you're having an interview or answering a survey or something like that. So then you're just kind of giving your opinion. And that is important stuff too. And in fact, I think, there's quite a few surveys that are embedded in all of us too. They're interested in those kinds of things. Then you probably, what's the next level? Well, giving your blood certainly is more of a scary thing. And then you have to start thinking about where is your blood going? There, you taking it, Dr. Dorothy takes my blood, and what happens to it? And so it's important to know those questions, the answers to those questions, if you are interested, or saliva. If you're giving some kind of biospecimen, is what we call it, you should be asking the questions about what happens to it and how is it protected. And you need to be comfortable with those answers before you would participate. But those are questions you need to ask, and people need to, and the researchers need to answer it to your satisfaction. So if you're in a situation where you're not getting answers, then that may not be the choice for you. And then probably the scariest is taking a drug or something like that. A clinical trial. Yeah. So, and again, the same things. You have rights to know the answers to all of your questions. And you should feel that you are safe in participating in research.
So research is just a way of asking questions in a structured way and not being too attached to the answer that you want. So you have to have some distance from the answer. So you ask a question, you collect information, you analyze it in a way to give you some sense of what the answer is. And then you try to figure out why you got what you got. It's not as mysterious as it sounds. But what's important is to know what is the question, why is the question being asked, how it's going to be answered, and if you decide to participate in a study, what will your participation involve? And that's why we have something called informed consent. So you have to be an informed consumer. It's just like going out and buying a car or working with a financial advisor. You want to know what's going to happen, how is it going to happen, can I get out of this agreement if I want to, can I say stop? And so those are the things that are built into the research process to protect participants. And it's good to be an informed consumer. And so we talk a little bit about research literacy, just like financial literacy. It's important to know what you're being asked to do and in deciding whether you want to do it or not. And there's a whole range of participation, again, as Dr. Passmore said, from answering questions, which are really important, that's epidemiologic research usually, and survey research, up to clinical trial participation. And some people are really comfortable going all the way up, but never doing a randomized controlled clinical trial, a treatment trial. It's just not what they want to do. But there are lots and lots of other research opportunities that are just as important that actually make it possible to do the clinical trial for the people who need or want to participate. And so each level has its own demands and its own benefits.
Yeah, it's really interesting because I like to you use my analogy that I love to use. No, you didn't steal it, but it's funny because I always think about research when I tell people you probably do more research than you know, and particularly women do a lot of research because we research in the store for hours. We will study a suit, we will study some shoes, we will look at all the details, we will put it in the cart, we will even go to the register, right? but we will make a calculated decision about our choice that we're about to make. And we do a lot. We will look online and say, okay, I can find this at a cheaper store, or I can find this in better material. So you think about that, takes and demystifies some of what research really is. It's like Doris said, it really is about asking a specific question and knowing that you're looking for an answer, but really not being married to the answer you think you're going to get, but being nimble enough and, quite frankly, objective enough to recognize the answer will present itself. And then you make some decisions of how you want to participate. But I wanted to talk also about recognizing that there are systems in place to protect participants in research. So the NIH, the National Institute on Health, right, has the Belmont report. We know that came out, and that talked about beneficence. It talked about justice. It talks about protecting participants in research. And that's where things like the informed consent came from. That's where things about understanding and knowing that what is written in the language is language that is readable and understandable for all participants. That's really important to know when you're thinking about, should I participate in research? And also in that informed consent, and also as a result of that Belmont report, you as a citizen who is interested in research, all of us in this room, no matter what point we start, we always have the right to say, I don't want to do this anymore. And it's really important to understand what happens to your data after you choose to discontinue participating in a study. Asking those questions is really important. So I try, and I think it's really important for us as researchers or as academic staff or whoever we are, it's particularly to this all of us research as we are coordinators, to really demystify the word research, because really everybody participates on some level. So wanted to just throw that out there.
Fantastic. And I have a follow-up question to that. So I think you all did a great job describing what research is, getting at demystifying it. But I personally have friends who will spread medical misinformation and say, oh, well, I did my own research. So, well, yeah. So I guess we're trying to democratize research, but we also don't want to empower people to spread misinformation or think they're doing research when they're actually not. So do y'all have an answer to that, to the misinformation question? Yeah, let's do it.
Or I'm not.
Hesitancy,
Okay. I wouldn't say I'm an expert on misinformation, but I have been kind of pulled into thinking a lot about vaccines because of the COVID-19 pandemic. And so I've been working with a team of researchers. We're doing work in rural Wisconsin about vaccine hesitancy, because now what we're seeing is there was so much hesitancy around COVID vaccine that now it's kind of spreading, and we're seeing less. And we're actually very interested right now in children's vaccines, because parents are not vaccinating their kids because there's been this level of doubt that's kind of gotten in there. And there is a lot of it is about misinformation. And there are lots of people on the internet. Some of that misinformation comes from people who are really bad actors. They're really trying to put misinformation and hurt people. There are other people who are just trying to make some money off of it. There's a lot of people who have, selling lots of different natural cures for whatever. So you've got to take that into consideration when you're doing your research. What is this person getting out of it? Is there a click here and put something in your shopping cart, on the website? That's an indication that their motivations might be not all that altruistic. But you just have to be really, really careful. And I think the best things to do is to talk to people who really know their stuff. So your doctor, if you're asking about vaccines, your doctor or some other health professional who you really can trust and that is the person to ask. Don't take anything you see off the internet. And there's just too much stuff going on. And it's very scary, actually. We're just in that place, unfortunately, where people really don't know who to trust. When we're talking to rural folks in Wisconsin, in Southwest Wisconsin, people are really hesitant to believe the CDC. Now there's been this level of doubt, and they never thought about the CDC before, but now all of a sudden, wait a minute, Yeah. So it's just important to go to those trusted sources of information for now. Anyways, I wouldn't go too much in the internet unless you're going to NIH or something like that. Well, then people don't trust the CDC.
Yeah. People don't trust the FBI either. That was a video, you guys. That was a video. That was a video. And on trust and trusting in research. And one of the persons said, "If it's the F, the B, or the I, I'm not doing it." And so that was a real person. But the other thing I think that's really important about this is recognizing, as what Dr. Passmore said, knowing our responsibility, quite frankly, as the people who are actually driving these studies, for us to be credible sources and to be as transparent as possible with information. So we need to make sure that, again, when changes are coming to our research studies, when controversial information is going to be released in in the studies, we need to be ahead of that, and we actually need to be talking to our participants about it in advance. We can project things, and we also need to make sure that we are staying in close contact and relationship with participants and community as a whole about, again, taking the untruths out of research. We often are reactionary, but I think as study I won't call us experts, that's the word I'm avoiding, but as study guides, right? And as the people who are really involved intimately with the study, our obligation and accountability is to put out credible information before it can do harm. And so that is one way I think, it's oftentimes we talk about what can the participants do or what can the community do. The question has to be flipped because it's bi-directional relationship. What can we do to be proactive? And I think that's something we need to talk about.
Yeah, I think that's a great next question. I want to give a chance to for Dr. Yinka to answer this as well. What do you think researchers can do to build this trust with the communities we're serving, with with everybody who would benefit from this research? So I'll let Dr. Yinka chime in.
That's a loaded question, and there's a lot of things that researchers can do to build trust. I'll start first with transparency, and I think it has already been mentioned by one of the panelists, is we need to be transparent about the research we do, the process, all the details. If somebody wants to participate in either a survey or participate in an all of us related study or clinical trial, we as researchers, we have to be transparent about every single detail of the study activities of that research. And that is one way that we can build trust with communities, is to let them know, this is all the things you're going to be doing. Is it going to take you 7 hours? Is it going to take you 5 hours? Are we going to draw your blood? These are all the details that we need to let them know. And as has also been said, if for any reason that changes, we need to let our communities know that we are making these changes and this is the reason why we are making the changes. Other things to think about is even transparency about what we're going to do with the data. And it's important for us to specify at the very beginning all the things that we are going to do with the data. Is it going to help with new interventions? Is it going to help with new treatments? A lot of the times, the reason why sometimes people mistrust research is because they just don't have enough information. They don't feel like they've received enough information in a way that they can understand in a health literate manner for them to now say, I really do know everything about this. And so I trust the research and I trust the researcher. And so it's important for that transparency to happen about the process. But I think it's also on us as researchers to be very authentic, especially about what we're doing. This is where the idea of swooping in into like, oh, I just want you to, you're just a subject is what you say, just for me to be able to fill my enrollment process. And I think one of the ways to do this is we need to be authentic. We need to treat people with respect. And as a way to build trust, we need to let people know that we are there not just to collect our data and be done, but we are there because we really care about the community, because we really want to enhance health equity. We really want to bring out new treatments that will eventually be helpful. And so it's on us. And that's why, you know, a lot of the times it's like, okay, what should the participants do? But it's like, what should we do as researchers to make ourselves trustworthy and authentic with the community that we are working with? And that also comes with giving the results back. A lot of times people just swoop in, get the data, and you never hear anything. And one other way to build trust is saying, you know what? We will present the results back. And that is the great thing that is fantastic about the All of Us program, is that ability for patients or for communities and participants to be able to see their data, to be able to see what is being used for, and for be able to get their results back. So there's a lot that goes into building trust, but those are just some examples that I wanted to highlight.
Fantastic. Does anyone else want to add anything to speaking to the researchers, what they need to do to build trust? I feel like we covered it. Yeah. She summed it all up. Yeah, then I think I'll pivot to the next question. So people watching, they want to take a hands-on, you know, they want to be hands-on with their health. They want to make sure they're doing the right things, getting the right treatments that they need. I know all of us is still in enrollment, still trying to come up with the discoveries. For the people watching right now, what can they do to make sure they're getting the best healthcare possible, or making sure they're getting the best treatments? What would be your advice? Who wants to take this one? Dr. Inkas, welcome. Or Dr. Edwards.
So I'll start. One of the things is to know your numbers, right? To really pay attention to your own health, so know what your risk factors are, so that you can prevent problems. I mean, it's well enough to look for treatments, but really we would all rather not have to do that. So we really need to know our numbers, know enough about ourselves, what our risk factors are, even the things that we don't like to know about ourselves, like how much weight we've gained, or what our blood pressure is, or how high our triglycerides are going. So if you know your numbers, you can begin to develop your own best way of addressing those concerns. And some of those are changing your behavior, changing your diet, getting more exercise, more sleep. We have learning is really important. Stress management, time with friends, all those things are health building. But if you don't know what your risk factors are, you're not likely to be as directed in engaging in healthy behaviors. And so I think prevention is the best defense. And then also, if you have problems, you have to find the practitioners whom you trust to work with you to treat them, right?
Sure. I think knowing your own numbers is really important, is what, Dorothy has said. But I also think one of the big things we miss is knowing our family history. That is really important. And in many communities, we don't talk about our health, and so we need to back up and really start having family meetings to talk about historical illnesses, historical traumas in our families, and really understanding the trajectory for our health. I remember when one of my friends who's a provider told me, you want to see what you're going to age like? Look at your mom. Pay attention to your mother. And boy, when I started paying attention, it got a little scary. But the reality is that's true. And so we need to start understanding and start asking questions about, what happened in our family health history. I think that's really one thing that we all need to start paying attention to.
Fantastic. Dr. Passmore, do you have something too? Or yeah, I mean, so know your numbers, talk about your health history with your family. And a follow-up question to that, and Dr. Yinka, you're welcome to take this one, or any of the panel, whoever wants to take it. So for the people watching, what are some trusted sources of health information they can go to if they want to have a hands-on stance with their health? Trusted sources of information for people who want to learn more and want to investigate. We had an audience member joked and said Dr. Google. But who wants to take this one? Dr. Yinka, do you want to take it, or any of the other panel members?
I can start. So the question is about who to talk to. We know that healthcare, we know that individuals who have been specifically trained, who are specialized and have the clinical training, have the clinical skills, who actually went to school to go get an education around healthcare are definitely one of the people that we can talk to. And so it's important for us, of course, to talk to our healthcare providers, our trusted healthcare providers. And that's one of the things when we're talking about providers is to make sure that you find the one you trust, and also find the one that you are having active engagement with, because if you don't like your doctor, just fire them and go find another one. And so definitely it's not just the doctor, it's the individuals within your healthcare team. The individuals are one of the people to think about if you have questions. One other one that I will also throw in there is talk to trusted messengers in your community, individuals that are in the community, people who are already partnering with academic institutions, because sometimes we want to hear from another community member about research. And sometimes we know that there might be distrust of a healthcare provider, but go talk to a community member, somebody that you know, somebody that you trust, maybe somebody in your community, somebody in your senior center who knows, or somebody in a community organization. Some of those organizations as well have trusted messengers in the community. It might be somebody that is part of your faith-based institution, like your pastor, and that you also know is connected to an academic institution, knows about research. And so it's nice to look within the healthcare system, but I think it's also nice to talk about that there are community people that are trusted as well, that we can look to if you're also looking for information. And then the last thing I would say is, when we're talking about misinformation, that is one of the biggest. Misinformation, disinformation is all in the world of trying to improve health literacy, is paying attention to the right site. Sites that don't have things like .org or .gov and things like that. Those are some particular Google, like someone said Google, but there's some information on the internet that you can actually get information from, but just paying attention to where those sites are actually linked to. Are they just linked to something that has a very suspicious link, or is it actually linked to something that is a government website, or is it linked to something that is like a clinical trial website or part of a university website? So those are just some examples to get us started.
I love it. Yeah.
Really short, and then I'll get to you. I think that the thing you have to think about is when you're looking for information is, one, is this person trustworthy? Right? Are they looking to do something besides something that's good for me? You know, whatever that is. And then the other thing is competence. Like, should they know the answer to this question? Because not everybody, even though you might really trust somebody, they might not be the right person to answer the question that you're asking, right? So I think that there's two parts of it: trustworthiness and, and why do they know? How should they know, right?
It's really interesting, but I have to give a shout out to nurses. The nursing network is amazing. It is in facilities, out of facilities, in communities. You've got traveling nurses, you've got community nurses, you've got hospice nurses, nurses are everywhere. And then nursing networks are amazing. And so I know for myself, when my dad was ill, it was the nurses who gave us the most credible information on earth. And that was really important. I also want to give out to clinician groups that are maybe non-traditional. So you've got these social work clinician groups, you've got mental health clinician groups, you've got all of these, and they are resources for research because they know multiple data points. They know different information. And then I also give it, trusted sources can be some of our organizations that we work with. So our departments on aging, so our aging departments, our social work departments, our DHS, the state departments. There are some folks who really can give us credible information, especially when it comes to our health. So we often overlook some of the governmental agencies, but they're credible and they really do offer good resources that we can actually tap into. So I wanted to say that, but I had to say, and parish nurses in the church. So when we mention church, we think, I'm sorry, Dorothy, great minds. Remember, you took my idea like last 5 questions, but it's okay. But when we think about church, we often think about pastors who are critical And we listen to the pastors, but the pastors often get information from the parish nurses. So we got to think about the parish nurses in the church as well. So I'll give you the mic.
So I want, right, true, that's true too. So I wanted to say that our public health system was really built on the legacy of public health nurses who did home visits, who were in the community. This wasn't that long ago. We're talking about the 1960s, maybe. And so public health nurses who then moved into organizations, parish nurses, community health workers who have not as much training, but often have the advantage of knowing the community as well as having competence because they've had some specialized training are a great way to connect, because sometimes, particularly if you have a problem that's scary, the first person you talk to, you want to be someone whom you trust, who's not going to frighten you. And so I think that using all of these resources and the move to put more into community, to go back to our community health programs, whether they be with nurses or community health workers or social workers or school-based nurses, for example, I think is really, really important. The other thing are the professional organizations who exist to provide accurate information to not only to professionals, but to community. The Alzheimer's Association, the American Heart Association, the American Diabetes Association, the American Parkinson's Association. These are people whose information is really well vetted. It's often online or in print. It's designed for lay readers. And so, but you know that it's accurate and up to date. And so I think that there are lots and lots of credible, trustworthy sources of information that can sort of take you to where you need to go as you sort of move up in terms of more greater levels of contact, so that when you go see your doctor, you have a list of questions in your hand, so that you're not just going to listen to what she says, but you go in with your own questions because you want to manage your own care. And the other thing I would say is don't ever be afraid to fire a doctor. Ever. Ever.
Or ask questions.
Or ask questions. But if your particular healthcare provider does not like the fact that you're asking questions, then that's a sign that you probably don't have a good fit.
So we're almost at the close. I want to see if there are any questions from our in-person audience. Then we'll check Zoom and Facebook. Yeah, Vivian's got one. All right. Make sure you're talking to the mic so our friends can hear you on Zoom.
Earlier, Dr. Passmore was talking about the different levels of research and how sometimes it's just surveys, but then you have clinical trials. And so what in your experience, what is the difference? What makes somebody say, I'm going all in versus, somebody, who just is like, no, I'm just going to do surveys? Because there has to be a compelling reason for them, I'm sure.
Yeah.
I think there's one really clear answer. And I think that's altruism. People care about the people around them. They want to help people around them. That's the answer, really. I think that sometimes people who are ill are looking for a cure or a treatment. Certainly, there's a lot of people in clinical trials who are doing that. But overall, people want to create good in the world. Hopefully helping their kids, the next generation, but also in the general population and their neighbors and friends and all of that. You want to add anything?
Well, all of the research on research participation supports what Dr. Passmore said, that when you ask people all over the country, all different kinds of clinical studies, why are you doing this? It's altruism. I'm doing it for my family. I'm doing it for my community. I really want to take this opportunity to help. It's not so much of my time. And I hope something good comes out of it. That is the first answer that the majority of people give. It's just amazing that finding has been replicated over and over and over again.
Yeah, that is the answer. And I think the word is hope. people are looking for hope. People are looking for future, and particularly if it's a disease that is currently uncurable. People want that. They know they won't benefit, but the next generation just might. That's hope. And so it's the same thing, but it really is the word that I hear often.
Dr. Yinka, would you like to add anything to that?
No, I don't think so. I think they said it, they really summarized and said it all. It's people want they want their participation to eventually benefit a generation. They want it to benefit somebody, eventually society, and most of the times that's one of the reasons why.
All right. I like this message of hope. We're loving it. I'm going to check Facebook really quickly to see if there are any questions there. If you're watching on Zoom, it's your last chance to get a question in. Let's go to our video on Facebook. Oh, we got one more in-person question before we check the Facebook. All right, I saw a hand up. Yes. Okay.
It's more of a comment versus a question. But you asked the question about what can researchers do to build trust. I think if we look at it from a broader lens, we would ask the question where it's two ways, because research is not just based on researchers, it's based on the participants. And so we, as researchers, oftentimes will not have every player at the table. And so as we talk about, someone mentioned the transparency. Transparency means looking at it both ways. And so how can we bring community to the table early on, when at the point of conception, instead of waiting until we've conceived and said, now we have this baby coming, and how are we going to take care of it when I didn't have any involvement in getting the person impregnated. That's an analogy. And then, what did you say, Dorothy? Okay, you'll remember that. Okay. The other thing was in regards to trusted resources that can be used. The grapevine inside of communities are the number one resource, because if my grandmother said this, it's Bible, and that's what we're gonna go with. What did grandmama say that has gotten us through 4 generations of individuals across the continuum? And so as we talk about resources, the lady down the street that you see everyone running to her house for, or the man, is not necessarily all the time bad, but they are resources that can direct you in the right direction to go for whatever it is that you're looking for. So, and in the case of research, they're going to ask the buzz on the street. Yeah, everyone has heard about all of us, but who actually has, followed through, registered, and know what it's about. Last comment is just in regards to the taking back to the community, asking, giving follow-up. Everybody fails that category in terms of research. There are small groups that take place, but when we talk about sharing the information from a layperson's perspective, I participated in a study a few months back, and one of the things that ended up happening was that the give back and take back was at a level, an intellectual level, where it took, a room full of PhDs and MDs and et cetera, when in essence, we were trying to elaborate on what was your lab results and what does that mean to you, and now where do you need to go? So, okay, husband just told me to shut.
No, that was wonderful. Thank you so much. I love it. That works as a summary for pretty much everything we talked about. So let's check on Facebook and see if anybody has any final questions over there. So we'll just go to the SciStarter Facebook page. I see some hearts, no questions there. We'll check Zoom. Last chance to get your questions in on Zoom. I don't see any more questions. Any final thoughts from our panel? Anything else you want to share with us before we go this evening? I know we covered a lot of ground. Well, yeah, this was fun. So for those who want to stay in the loop, make sure you follow all of us on social media. All of Us Wisconsin was the co-sponsor for this event, so follow their accounts as well. You can go joinallofus.org to stay in touch in that realm. We do have a survey. So I'm just going to share my screen and show the survey for the people watching on Facebook, for the people who are in person, as well as for the people who are watching on Zoom. Please fill out our survey and let us know how we did, how we can do things better. It's at links.asu.edu/csm-participant-survey-15. It's kind of a mouthful, but we know you can find it. And otherwise, for those who are here in person, stay after, have some Jimmy John's, enjoy the tabling. And thank you again to Dr. Yinka on Zoom for joining us and for everybody who was tuning in online. We appreciate you. Woo! All right, we'll leave that survey up for a little bit. Zoom folks, feel free to head out. I'll be monitoring the chat for a little bit if people have follow-up questions, but otherwise, thank you so much. Event closed.
Great, Caroline. Thank you. Right. Thanks, guys. Right. Like sauce. Yeah. Sandwich. I'm gonna eat a salami sandwich. Is it good? I'll try one. I'll try. Oh, my legs hurt. Actually, exactly. That's what happened in Georgia. Somebody here. Somebody always how much of it life-saving thing? Have like real connections to that network. And that's right, right. And that's who should be there. That's actually a great intervention. That can work actually in rural grandparents or elders. The elders. So I gave you my email for you. I'll be here. Yeah, I'll send you. Yeah, nice. Okay. If you need me, get ready for early morning. Did y'all like it?